Healthcare costs,
health insurance costs,
or health insurance.
Healthcare subsidies
or health insurance.
health insurance premiums,
And when people don't have their health care, they often are sicker, use the emergency room more, and the quality of life just isn't there.
In the Declaration of Independence, one of the fundamental principles established is the pursuit of happiness. To uphold this principle, the citizens of the United States should possess the opportunity to live happy, healthy, and fulfilling lives. This includes having stable housing, access to quality education, and the ability to work towards meaningful personal and economic advancements. Essential to these conditions is the availability of affordable health care. However, many Americans are experiencing a significant rise in healthcare costs. Insurance premiums and medical expenses are increasing at unprecedented rates, placing additional burdens on individuals and families who are already struggling to meet their financial obligations. As a result, frustration and dissatisfactions are growing among citizens who are calling for equitable and immediate reform. This issue remains persistent and urgent, requiring prompt and effective resolutions now more than ever.
Despite this progress, it was inevitable that Obamacare's affordability crisis would eventually increase the number of uninsured, and that is exactly what the latest census data show. The fact is, 85% of the 1.9 million newly uninsured in 2018 occurred among people with incomes higher than 300% of the federal poverty level. These are people who do not qualify for large ACA subsidies and represent a new class of uninsured, those that can't afford Obamacare's premiums.
The average premium per family has gone up to $26,000, outpacing inflation in just a few years. The issue of healthcare is not faced by just one group of people, but by many across America. As of October 2025, at 59%, Arkansas is receiving the highest proposed range of premium rate increases in America. This isn't an issue that started in the year of 2025, but between the years of 2011 and 2021, premiums for employer-sponsored health insurance have been bumped up by 47%. Some people blame this on insurers, drug companies, and employers, but others blame it on the 2025 government shutdown.
Part of the reason why we're in a government shutdown right now is because they are negotiating what to include in their appropriations bill. And so it's really important for the government to fund federal tax credits, or else health insurance is going to be really unaffordable for a lot of people, and people might choose to just not have insurance at all.
After the government shutdown, healthcare prices did rise. Subsidies that helped cover premiums were a sticking point of the shutdown. The spike in healthcare premiums prompted lawmakers to introduce the Affordable Care Act. However, the reform failed to curb rising costs and in some cases intensified them.
20 million Americans would see a doubling in their healthcare premiums through the Affordable Care Act. 20 million. That's on average. In my state of Vermont, I'm hearing from people who are looking at a tripling or a quadrupling of their health insurance premiums. People cannot afford that. And as a result, people will lose their health care.
In fact, in 2024, the top cause of bankruptcy in the U.S. was health care-related debt. This just proves to show how high costs and how much stress the healthcare system can cause amongst Americans. Healthcare premium costs have been increasing and increasing over time, hurting many Americans, especially those who are in financial stress.
As anger at United Healthcare boils over, Americans pay more than ever for insurance.
It was definitely a freeze response. I cried off and on for a good hour, just tried to kind of keep myself from going into a full-blown panic attack.
Lauren Koff's health insurance premium is going from $244 a month to $1,026, a hike of over 300%. She showed me the Florida Blue notice explaining the loss of the health care subsidy currently due to expire in January and the subject of a congressional stalemate.
I was expecting my costs to maybe double, maybe go up to $500, maybe at the most $600, but to see it over $1,000 was beyond shocking.
Madonna Marshall in Apex says she's already dialing back her spending on certain food items and cutting back on recreational activities.
Going back to the Declaration of Independence, let's try to answer just one question. Are we truly upholding the Declaration's promise of the pursuit of happiness when it comes to providing health care?
The government is aware of many people having a hard time paying for their insurance and health premiums. Instead of helping and supporting the people, they decide to use it for everything else. They are able to fund other countries which have free healthcare, while we, the American citizens, don't have free healthcare. These problems really affect people's lives and the way they live. They might not be able to get necessities for the only reason being they need to pay for their premiums and they don't have enough money.